Hello everyone, this is Dr. Apurva Kulkarni. I'm consultant pediatric surgeon, pediatric laparoscopic surgeon and pediatric urologist. Today we'll have a small session on parent awareness regarding some conditions in their children that they should be aware of. First, a short introduction of myself. I'm a pediatric general surgeon, laparoscopic surgeon and urologist. I finished my graduation in MBBS from TNMC and BYL Nair Charitable Hospital way back in 2005. After that, I did Masters in General Surgery from Indira Gandhi Medical College in Nagpur. And after that, I did super specialty in pediatric surgery from LTMG Hospital in Sion. So in this session, what are we going to discuss? When to show your child to a doctor and when to show a child to specifically a pediatrician, and also when to show a child to a pediatric surgeon. So what are the conditions in which you should show to these different specialities, and by chance, if at all if you are not sure which specialist to show your child to, it's best to take your child to a children's hospital in which all specialities and all facilities are available under one roof. So what are some of the common problems that we are going to discuss here that occur in children? Swelling in any part of the body, any pain in any part of the body that a child complains, persistent fever despite taking treatment for the same, and urination and defecation problems which are quite common in all children. So some of the common conditions that we see here is one of those conditions. It's called a lymph node swelling. This swelling generally occurs somewhere in the neck, but it can also occur in the axilla. This swelling appears as you can see in the photo. The girl on the left side, the swelling is very small, while the boy on the right side, the swelling can become quite big. So what are lymph nodes exactly? Lymph nodes are like police stations in various parts of your body. They help in fighting infections. So infection in any part of the body goes to the local lymph nodes, and when the lymph node helps in fighting the swelling, the lymph node becomes enlarges basically in size. Most of the times the treatment is with antibiotics. The lymph node swelling decreases and can go completely also. In some cases where the lymph node size does not decrease with antibiotics, they might require removal and require to send for biopsy. Another common condition is what is called as an abscess. So what is an abscess exactly? It's a cavity in any part of the body filled with pus. So pus is formed after your body fights bacteria or any infection, it results in pus. So pus as a rule in any part of the body does not subside without drainage. It has to be taken out. In very, very rare conditions, abscess can settle with the help of antibiotics, but most often it requires drainage. As you can see on the right side, it's probably a furunculitis, which has resulted in formation of pus. It occurs at the base of the hair follicles. And the baby on the right, it's a lymph node abscess. It has occurred inside a lymph node after it has fought the infection, and pus has formed in that localized area. Some of the common conditions which might require surgery, we will discuss now. One of them, probably the most common condition that we as pediatric surgeons come across, is an inguinal hernia. So how does it appear? It appears as a swelling in the groin. It generally appears and disappears intermittently. So when the child plays around, moves around in the house, outside during the day, you will see the swelling appear, and when he lies down or goes to sleep at night, the swelling will go down, the swelling will disappear. Sometimes the child can also complain of pain in the associated area because of drag in that area. it does not resolve on its own. An inguinal hernia will always require surgery. There is no conservative management, and you have to be aware of that. And in fact, because of some of the associated complications like obstructed hernia and strangulated hernia, I advise my patients to get operated as early as possible. Hernia surgeries is of two types. It can be an open surgery or it can be done laparoscopically. Generally, I prefer to do laparoscopic hernia after 1 year of age. It is a very safe and useful surgery, especially in those patients where the hernia is present on both sides. And because of the very small size of instruments that we use in pediatric patients, the scars that result are almost invisible. Another common condition is a hernia of the navel, of the umbilicus. It's called an umbilical hernia. This type of hernia has a chance of getting resolved on its own depending on the age of the patient and the size of the hernia or the hernial defect. Generally, by age 2 or 3 years of age, it can get resolved on its own. The surgery is then not required. But if around 2 or 3 years of age, depending on the size of the defect, the hernia does not resolve, then we advocate surgery. This type of hernia also has a chance of getting obstructed or strangulated, so the parents should be aware of this complication. And this can get the strangulation or the obstruction can happen at any time in the baby's any age basically. Another common condition that occurs in boys is hydrocele. What is a hydrocele? Hydrocele is accumulation of fluid in the scrotum of a boy. It can happen on one side or both. This also has a tendency to resolve on its own by approximately 1.5 to 2 years of age. So we generally do not operate before 2 years of age or 1.5 years of age. This accumulation of fluid does not have any harm to the testes as such, and the surgery is required only after 2 years of age if it does not go on its own. Phymosis is a condition that occurs in many boys. Almost more than 50% of the boys at birth have this condition. What is phymosis? It's a tightness of the foreskin of the penis. This also resolves by approximately 1.5 to 2 years of age, and if the patient does not have any complaints, then we can also wait till around 5 years of age for it to resolve. But if the patient develops any symptoms like difficulty in micturition or urinary tract infection rarely, he will require treatment. Treatment can be in the form of non-surgical as well as surgical. Generally, we start with the non-surgical treatment like local ointments and sitz bath. But if it does not help or does not resolve the problem, then the patient might require surgery. Surgery also is of many types. Commonest surgery performed is a circumcision where the foreskin is removed. But in some cases, foreskin saving surgery can also be considered. Undescended testes is a condition where the testis of a boy does not come down to the scrotum at birth. If this happens, then the testes can be in any of the following, any of the positions that can be seen in the diagram. If at birth it's not there and in the scrotum, then it can come down till about 6 months of age. If it does not come down by that time, then a surgery is advocated between 6 months to 1.5 years of age. The only thing that the parent should keep in mind is later the surgery, more the chances of decreased fertility. So I have got patients coming to me at 3, 4, 5 and even 8 and 10 years of age. So it's not advocated to wait that long. Ideal time should be kept in mind by the patients. What type of surgery will be required? will be decided by the surgeon depending on where the testis is there in the body. If it's inside the abdomen, generally laparoscopic surgery is required. If it is in the groin or closer to the scrotum, open surgery can suffice. Specific to females, girls, Lobel Synergy is a condition where the labia minora of the girl are stuck together in the midline. The girl generally comes with a complaint of difficulty in maturation and can sometimes have an infection in the urine. Over here, as you can see in the photo, the urinary opening is partially covered and the vagina is totally covered, so it's not visible. This is a very small condition which requires an outpatient procedure. It can generally be done under local ointment anesthesia. The important thing to remember is to prevent the recurrence, good local hygiene has to be maintained. Urinary tract infection is generally not so common in girls as compared to boys, but if it is found, if it is present, it needs complete evaluation. A common condition which can occur in girls as well as boys is a vesiculated reflux. In this condition, the urine along with coming out of the urethra can also goes back into the ureter. It can occur on one side or both sides of the kidney. This also generally, if depending on the grade of the reflux, antibiotic treatment can suffice and resolve the reflux, but if the grade and severity are more, surgery is required. I think most of the children, parents must have observed that they complain of abdominal pain sometime or the other. So this is because most of the abdominal pain that you see is intermittent, and it is caused because of a condition called intestinal colic. It does not require any treatment generally, or can suffer symptomatic treatment with a mild painkiller can suffice. But if the pain remains persistent, then it's better not ignored. There are various possibilities which can lead to a persistent abdominal pain. Some of the possibilities can require surgery, and especially if the pain is accompanied by vomiting and fever, then an urgent evaluation will be required. Appendicitis is a very common condition even in children and should not be ignored. This is also a very common condition that we see in most of the kids these days: constipation and bleeding in stools. So they both can be related. Constipation is most often habitual or dietary. Habitual is when they are not yet toilet trained and they sometimes are scared in passing stools while sitting on the seat. So appropriate toilet training along with timing and age of the training is required to prevent constipation. Constipation can also lead to blood streaks in stools, which can cause pain in the anal area also. There are also different causes of blood in stools. If the blood does not stop after treatment of constipation, then more evaluation needs to be done. Polydactyly is also a relatively common condition. It's called extra finger. The extra finger can be present on the side of the little finger or on the side of the hand, on the thumb side. Very rarely it can also be present in between the other fingers also. Most often there is no bone in that extra finger, and to prevent infection in that soft tissue of the extra finger, it is better to be removed. It is a very small OPD procedure. But if bone is present, then if removal is advocated by the parents, then a complex surgery might be required. But even with bone, generally removal can be avoided as well. So what is the take home message that I want to give here for the parents today? Do not ignore your child's complaints. Generally, children do not complain anything regarding their bodily complaints if they don't have a problem with it. If your child is complaining about it, that means there is a problem. What you think might be trivial, it might be an indication of something which is more serious underlying. It's better to consult a specialist doctor only, a pediatrician or a pediatric surgeon or a specialist pediatric surgeon like a neurosurgeon for whatever complaints your child has. Research a little bit about which doctor you are going to show, and once you go to that doctor, the specialist, then it's your job to trust your doctor. Don't try to search on Google about what the symptoms that your child has, what conditions that your child may be having. Google gives a lot of information. Most of it might not be relevant to your child. Second opinion is your full right, but a third, fourth, and fifth opinion might end up confusing you more. And in no way should you compromise in your child's health and treatment. If you don't know, if you are confused about which doctor or which specialty to show, it's best to take your child to a pediatric hospital. Thank you.